Hey guys, this is Fixer Med. Welcome back to my high yield anatomy review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. In this series, I will be covering a broad overview of the discipline of anatomy across various organ blocks for these examinations. This will be part 57 of my multi-part video series of doing so. Without any further delay, let's go ahead and get started on today's content. Let's start off by taking a look at clinical testing actions of extraocular muscles. Medial rectus. Ask the patient to look directly medially. Lateral rectus. Ask the patient to look directly laterally. Superior rectus. Ask the patient to look laterally, then superiorly. Inferior rectus. Ask the patient to look laterally, then inferiorly. Superior oblique. Ask the patient to look medially, then inferiorly. Inferior oblique. Ask the patient to look medially, then superiorly. Let's next take a look at oculomotor nerve palsy, also known as external squint. Affects most extraocular muscles. Manifestations: ptosis, fully dilated pupil. Eye is fully depressed and abducted, down and out, due to unopposed actions of the superior oblique and lateral rectus muscles. Let's next take a look at trochlear nerve palsy, also referred to as fourth cranial nerve palsy. Lesions of this nerve or its nucleus cause paralysis of the superior oblique muscle, impairing the ability to turn the affected eye inferomedially. Pupil looks superolaterally. The characteristic sign of trochlear nerve injury is diplopia, double vision, when looking down, for example, when going downstairs. The person can compensate for the diplopia by inclining the head anteriorly and laterally toward the side of the normal eye. All right, guys, now that we have covered all of the content, let's go ahead and take a look at some questions to review the knowledge you have gained so far. A 50-year-old woman presents with double vision and difficulty reading. On examination, you ask her to follow your finger with her eyes. When asked to look medially and then downward, she reports double vision and difficulty moving her left eye. Which of the following extraocular muscles is most likely affected? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is E, superior oblique. The superior oblique muscle is tested by asking the patient to look medially and then downward. The patient's double vision and difficulty moving her eye in this direction suggest an issue with the superior oblique muscle, which is responsible for depresses and abducts the eye. Dysfunction of this muscle often results in problems with tasks that require downward gaze, such as reading. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. The medial rectus is responsible for adducting the eye, moving it medially, and issues with this muscle would present as difficulty looking medially, not downward. B. The lateral rectus abducts the eye, moves it laterally, and dysfunction would manifest as difficulty moving the eye laterally, not medially or downward. C. The superior rectus elevates and adducts the eye, so issues here would cause difficulty looking upward, particularly when the eye is already abducted. D. The inferior rectus depresses and adducts the eye, so problems with this muscle would cause difficulty looking downward when the eye is already abducted. All right, now that we have covered this question, let's move on to look at the next question. A 60-year-old man presents with drooping of his right eyelid, double vision, and difficulty moving his right eye. On examination, his right eye is deviated downward and outward, and the pupil is fully dilated. Which of the following nerves is most likely affected? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is D, oculomotor nerve. The oculomotor nerve, cranial nerve 3, controls most of the extraocular muscles, the levator palpebrae superioris, and the sphincter pupillae muscle. Oculomotor nerve palsy results in ptosis due to paralysis of the levator palpebrae superioris, a fully dilated pupil due to loss of parasympathetic innervation, and the eye being down and out due to unopposed action of the lateral rectus and superior oblique muscles. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. The optic nerve is responsible for vision, not eye movement or pupil size, so damage here would result in vision loss, rather than eye deviation or ptosis. B. The trochlear nerve innervates only the superior oblique muscle, and its palsy would result in difficulty looking down and in, not the down and out position. C. The abducens nerve innervates the lateral rectus muscle, and its palsy would cause an inability to abduct the eye, not ptosis or pupil dilation. E. The facial nerve controls the muscles of facial expression and does not affect eye movement or pupil size, so its palsy would present with facial muscle weakness, not the ocular symptoms described. All right, now that we have covered this question, let's move on to look at the next question. A 45-year-old woman presents with difficulty reading and walking downstairs due to double vision. She has noticed that tilting her head to the left improves her symptoms. On examination, her right eye appears to be deviated upward and slightly inward when looking straight ahead. Which of the following nerves is most likely affected? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is D, trochlear nerve. The trochlear nerve, cranial nerve 4, innervates the superior oblique muscle, which is responsible for depressing and intorting the eye when it is adducted. Trochlear nerve palsy results in difficulty with downward gaze, particularly when the eye is looking medially, causing vertical diplopia, double vision. The patient's symptoms of double vision when reading or descending stairs, and improvement with head tilt, are characteristic of trochlear nerve palsy. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. The optic nerve is involved in vision, not eye movement, and its damage would result in vision loss rather than eye deviation or diplopia. B. The oculomotor nerve innervates most of the extraocular muscles, and its palsy would result in ptosis, a fully dilated pupil, and the eye being down and out, not the upward deviation described. C. The abducens nerve innervates the lateral rectus muscle, and its palsy would cause the inability to abduct the eye, resulting in horizontal diplopia, not the vertical diplopia and upward deviation described. E. The facial nerve controls the muscles of facial expression and does not affect eye movement, so its palsy would present with facial muscle weakness rather than ocular symptoms. All right, guys, that is all I have for the video today. As always, be sure to leave a like and subscribe to the channel for more videos like this if they are beneficial to you. If you have any questions, comments, or concerns, please feel free to type them up in the comment section below. Anyways, guys, this is Fixer Med signing off. Be sure to have a great day, everyone. Good luck studying as always, and goodbye.